Check your state and facility policy to make sure you are permitted to perform this procedure. Before you begin, perform hand hygiene and follow any other instructions provided in the preparation section of this program. To transfer a patient from the bed to a wheelchair, first determine his weight-bearing ability, ability to cooperate, and arm strength by asking the charge nurse, reviewing the care plan, and observing the patient. This patient can bear weight partially, cooperate, and use his arms, so the nurse assistant will use the stand and pivot technique with a transfer belt. With the wheelchair positioned so that the move will be toward the patient's stronger side, lock the wheels and remove the leg rests or swing them out of the way. Lower the bed to the lowest position, lock its wheels, and lower the side rail.
Put the side and have you turn on your side, Mr. Kenneth.
Turn the patient to one side with his knees bent. Raise the head of the bed to the highest position. Wait a few moments and ask if the patient feels dizzy. If he reports no dizziness, face him with your feet comfortably apart and with a broad base of support to increase stability and balance and avoid twisting and muscle strain. Have the patient use his arm next to the mattress to push off while you help lift his upper body to a sitting position and help swing his legs over the edge of the bed. Let the patient sit on the side of the bed and dangle his legs for 1 to 2 minutes.
I'm not dizzy. My arm is just hurting a little.
Okay. And is it weak?
Yes.
Weaker than this one?
Yes.
Okay, and how's your leg?
Once the patient is sitting upright, apply the transfer belt over his clothing and around his waist.
Now this belt will feel...
Tighten the belt so it's snug but does not cause discomfort or impair breathing. You should be able to slide your fingers under the belt. Help the patient put on non-skid slippers or shoes, move to the edge of the bed, and place his feet flat on the floor and comfortably apart. Spread your feet apart. To move your center of gravity closer to the object to be raised, bend your hips and knees. Block the patient's feet with your feet and brace your knees against his to help stabilize his knees when he stands. Grasp the sides of the transfer belt, or its handles if it has them. If the patient is able to help, tell him to push both hands down on the mattress and stand on the count of 3. Rock him up to a standing position while straightening your hips and legs and keeping your knees slightly bent. Maintain the stability of the patient's weak leg with your knee. Ask the patient if he is dizzy. If he is not, turn and move him toward the stronger side so that his back is toward the wheelchair. Have him reach for the arm of the chair. Instruct the patient to use the armrests for support and to ease himself into the wheelchair. Bend your hips and knees to lower him into the wheelchair. After the patient is securely seated, ensure proper alignment, help him place his feet on the footrests of the wheelchair, and position the wheelchair as desired. If required by facility policy, remove the transfer belt and, if needed, provide pillows to support any paralyzed or weak extremities.
Okay.
How does that feel?
Feels good.
Good. Okay, let me go ahead and get your newspaper.
Doing fine.
Do you want to kind of shift a little bit? Kind of wiggle?
As part of your follow-up care, remind the patient to shift his weight every 15 minutes. Perform hand hygiene and report completion of the procedure and your observations to the charge nurse. See the follow-up section of this program for detailed information.